So hello everyone, hope you're all doing good. In this video we are going to discuss about contraception. See, contraception is a big chapter, okay. I have divided it into 4 parts. In this video we are going to discuss about the natural methods of contraception as well as the barrier contraceptives. So let us move to the topic. So we are going to discuss about contraception. So what is contraception? It is a procedure to prevent conception, okay. That means we can even prevent fertilization also, okay. So to prevent conception or prevent fertilization, that is all about contraception. So when we talk about contraception, which can be an ideal contraceptive, okay. So what are the characteristics of a ideal contraceptive? An ideal contraceptive should be 100% effective. The effect of contraception should be reversible whenever the couple wants to conceive. So it should be a reversible one, and it should be easily accessible and cheap. It should not, or it does not interfere with the sexual pleasure. It should also have non-contraceptive benefits, okay. Apart from contraception, non-contraceptive benefits should also be there. We will be discussing it shortly. And it should be highly acceptable, okay. So these are the characteristics of a ideal contraceptive. So once again I will come up. So it should be 100% effective, it should be reversible, it should be easily accessible and cheap, it does not interfere with the sexual pleasure, should have non-contraceptive benefits, as well as it should be highly acceptable, okay. Next one, we have a WHO classification of contraception. So WHO classification groups the contraceptive into 4 tiers, okay. So according to their effectiveness and their failure rate, okay. So taking these two into consideration, it is divided into 4 tiers. So what is effectiveness? Effectiveness means most effective contraception means it is less than 1 per 100 women years, okay. And if it is less effective means it will be more than or equal to 30 per 100 women years, okay. So that means it is nothing but how to define the failure rate, okay. So if you take failure rate, it is given as number of accidental pregnancies divided by total months of exposure into 1200, okay. So example, the failure rate is said to be 5 per 100 women years, okay. So this means if the couple uses that particular method, okay, that particular method of contraception, say for a period of 1 year, then 5 women will become pregnant. Clear? So this is how it is represented, the failure rate. Clear? Next one is, we have to know in which and all these failure rates are more. So failure rate of contraceptives are more in teenage group, when they are unmarried, when she is a multiparous woman, or when they are desiring of pregnancy. Clear? Now, let us see what are the 4 tiers. Okay. So, we have 4 tiers of contraception. Okay. So, let us see the first tier, second tier, third tier and fourth tier. Okay. So, let us discuss this. First tier means it is most effective group. Okay, the effectiveness of these kind of contraceptive methods are more effective and the failure rate is said to be very less, that is less than 2 per 100 women years. So, this group will include your implants, IUDs and the female and the male sterilization methods. Clear? And next one is second tier. This is also very effective. Failure rate can be anywhere between 3 to 9 per 100 women years. And this category will include injectables, lactational amenorrhea, using any patch, pills or vaginal rings. Clear? Third tier is an effective one where the failure rate is between 10 to 20 per 100 women years, and this will include condoms, both the male as well as the female condoms, then your diaphragm, fertility awareness methods, okay, or it is FAMs, fertility awareness methods. And the fourth tier group is the least effective one, which is 21 to 30 100 women years. Okay, and this group will include your withdrawal and your spermicidal method. Clear? Right. So, these are the 4 tiers of classification of contraceptives. Now, contraception can also be classified into another way, like contraception can be temporary or a permanent contraception. Okay, so the temporary contraceptive methods will include natural methods, okay, hormonal methods, that is contraceptive pills, barrier methods, intrauterine devices, emergency contraceptive, and here non-steroidal oral contraceptive. Okay, your permanent methods of contraception will include obviously your female and male sterilization. Okay, now when you want to counsel a couple about contraception, we have something called a gather approach. Okay, so this is the approach by which you have to counsel the couple. Okay, so what does this gather means? We have to expand this gather. Okay, G means greet, then ask. Okay, first you have to wish the couple, then you have to ask what is the need, then you have to tell them what are the available options, then help them to choose one of the best options which is suitable for them. Then explain about that particular option, what are the benefits, what are the side effects, okay, they will have, and about the fertility rate even, and how the return means the returning back of fertility will be there if they use that particular contraceptive method. Okay, everything should be explained. Okay, so gather approach is a 6-element approach of counseling regarding contraception. Okay, right. Now we'll see one by one. The first one is natural family planning methods. First one, we have the fertility awareness method. Fertility awareness methods. So what is the concept of this fertility awareness method means? We have to avoid sexual intercourse during the period of ovulation. That is the thing. Okay. So to avoid sexual intercourse around the time of ovulation. Okay. We know roughly if the menstrual cycle is consisting of 28 days, in our 28 days cycle, ovulation will be happening around the 14th day. Okay. So let's see what are some of the methods of fertility awareness. First one is rhythm method, which is a calendar method. It is also known as calendar method. Okay, and this can be applied only when the woman has regular cycle, that is 28 days cycle. That means her ovulation date should be on day 14. Okay, so in this you can consider the safe period. Okay, safe period is considered up to the first 7 days of the cycle as well as the last 7 days of the cycle. Okay, so obviously when this is happening, what is the unsafe period? Unsafe period means usually around day 14. Okay, and it is day 18 to 19 of the cycle. These are considered to be the unsafe period. Clear? Now suppose if she is saying that no ma'am, I am not having regular cycles, I have irregular cycles, then how you will counsel repeating? Suppose she is saying no ma'am, I am not having regular cycles, I have irregular cycles, then how you will counsel her? See, when she is having irregular cycle, you have to collect details on her shortest cycle and her longest cycle. Okay, then the first day will be the shortest cycle minus 18. Okay, so this will be considered as the first day of the unsafe period. Okay, see, unsafe period's first day will be the shortest cycle minus 18 and the last day will be the longest cycle minus 11. Clear? Now, we'll see about cervical mucus method, which is otherwise known as billing method. Okay, it is also known as billing method. Okay, so when we take cervical mucus, the consistency of the cervical mucus changes according to the phase of menstrual cycle, right? So it can be Suppose if there is proliferative phase means the secretion will be according to the estrogen action, then it will be thin, watery, there will be abundant secretions, elastic in nature, and something called as spin bar kite will be there. Okay, what is spin bar kite? It is nothing but the mucus can be stretched. Okay, stretched between the fingers. Okay, next one is secretory phase. Okay, in secretory phase, which hormone will be acting? It is the progesterone hormone. So, progesterone hormone will be acting, the mucus will be thick, and here only scanty secretions will be there, which are not elastic, okay, and they cannot be stretched as well. Clear? Right. Now, in this, when to confirm which is a safe period and which is an unsafe period. So, safe period is the first 4 days of the cycle. Okay, that means dry days, these are dry days. Okay, other than the days of unsafe period. Okay, these are the days other than the days of unsafe period. Suppose, so when you confirm your unsafe period, yes, from the 5th day of a cycle, that's from the 5th day of the cycle. Okay, especially the days 10 to 14 when the secretion is egg white in color. Okay, so this means this is the period when ovulation is going to happen. Clear? And the next method is basal body temperature method. Okay, here which hormone is going to play? It is the progesterone hormone. Okay, so it is the progesterone hormone which is going to increase the basal body temperature up to 0.5 degree Celsius. Now here how we can know the safe period and the unsafe period? See, here safe period is again the first 4 days of cycle, and unsafe period is from the 5th days of her cycle. Okay, there will be increase in basal body temperature till 3 days after that. Clear? Next one is symptothermal method. Okay, so what is this symptothermal method? Okay, symptothermal method is a combined cervical mucus and basal body temperature method. Okay, so the next method we have is lactational amenorrhea or otherwise LAM. So in this method there is increased prolactin levels, okay, because it is happening during lactation, right? So the period of amenorrhea following lactation, that is lactational amenorrhea. Obviously we know during this period there is increased amount of prolactin. Okay, so this will cause negative feedback on gonadotropin releasing hormone. So what happens? There is reduction in the production of gonadotropins as such, which will include your luteinizing hormone and follicle stimulating hormone, and following this, the ovulation does not occur. Okay, so this is how lactational amenorrhea is going to act. Okay, so the increased reproduction is going to give a negative feedback on the gonadotropin releasing hormone. So there is no production of the gonadotropins, which is the follicle stimulating hormone under the luteinizing hormone, and so ovulation is not going to happen. Clear? Right. The next one is, remember, lactational amenorrhea is a contraception of benefit only when there is exclusive breastfeeding, okay, for a period of 6 months. Then it is also effective when more frequent feeds are given to the baby. Okay, so if both these things are tick marked, then ovulation does not occur up to 3 months. Fine. Suppose if the woman does not breastfeed, or there is introduction of supplementary feeds, so during this time the frequency of breastfeeding is reduced, right? So in that case, this is effective only up to 3 weeks. So this is the point I want to tell you. If she is exclusively breastfeeding, okay, then lactational amenorrhea can be considered up to a period of 3 months. But when there is introduction of supplementary feeds, or the number of feeds she is giving is reduced, the frequency is reduced, then it can be considered only up to 3 weeks. Very important. Okay. So what are the disadvantages of this method? Lactational amenorrhea. See, there is a high failure rate. Okay, there is a high failure rate. It requires high motivation and ability to follow the instructions. And next one is, it also requires the partner's cooperation, and there is no protection, okay, from sexually transmitted infections, especially the HIV. Okay, fine. Next method is withdrawal method. It is also known as coitus interruptus. Okay, so it is withdrawal method or the coitus interruptus. Okay, so this is the method where the penis is withdrawn from the vagina before ejaculation. Okay, so again there is a disadvantage in this method. The disadvantages here also, motivation should be high, and yeah, that's it. Okay, so this is the main disadvantage. Let's now discuss about the barrier methods of contraception. Okay, so let us discuss about the barrier methods of contraception. Okay, now barrier methods of contraception includes a wide variety of barriers which can be used both in the male as well as in the female. Okay, so this will include male condom, female condom, then occlusive tabs including diaphragm, cervical cap, then spermicides like creams, jellies or suppositories, and finally today sponge contraceptive. Clear? So these are the methods of barrier methods. Male condom, female condom. We have occlusive caps including the diaphragm as well as the cervical cap. We have spermicides that can be in the form of creams, jellies or suppositories, and today sponge contraceptive. Okay. Now let us discuss about male condoms. Okay, now male condoms are made from latex rubber or polyurethane. Okay, it is available in various colors and shapes. It has two ends. Okay, so one end will be a closed one and the other end has an inbuilt rim. Okay, if you see this picture, this is a picture of a male condom where you have a closed end, okay, and the other end has an inbuilt rim. Okay. So usually the length of the male condom varies between 15 to 20 centimeter. The diameter is between 3 to 3.5 centimeter and thickness is around 0.03 to 0.07 centimeter. Okay. Also, some condoms are provided with spermicidal jelly, okay, especially the nonoxynol 9. Okay. Condoms are provided by the Government of India in the name of Nirod and it is available free of cost. What are the advantages of using condom? Okay, so advantages of using a male condom. It is safe, effective and less costly. It is highly effective in protection against sexually transmitted infections like HIV, chlamydia, syphilis, gonorrhea, etc. It is ideal for couples having infrequent intercourse. Number 4, no prescription needed by any medical professional and no assistance or help also needed. Okay, so these are some of the advantages of using male condoms. Okay, let's see some of the disadvantages as well. So disadvantages: interferes with the sexual pleasure, condom can break through coitus, so during coitus, and the failure rate is more than the combined oral contraceptive pills or intrauterine devices. It will be between 2 to 12 per 100 women years. And fourth one, hypersensitization can occur. Okay. And apart from these advantages and disadvantages, you also have some non-contraceptive uses of condom. Okay, this will include, as we have already discussed, there is prevention of sexually transmitted infections. Number 2, for doing transvaginal ultrasonogram, over the probe you will be putting the condom. And number 3 is condom tamponade, that is used in a case of postpartum hemorrhage. Okay, so this is all about your male condom. Next contraceptive method we are going to discuss is the female condom. Female condom is made up of polyurethane. It has 2 rings at 2 ends. Okay, and the 2 ends, one will be open end and other will be a closed end. So this is a picture of a female condom. You have flexible rings, and remember, the rings in a female condom is present on both the sides, and among this one will be a closed end. Say this is to be closed end, this one will be a open. Clear? So here the closed end will be lying behind the symphysis pubis, whereas the open end will be lying beneath the cervix. Okay. So female condom is 17 centimeter long and 7 centimeter in diameter. Usually this is pre-lubricated with dimethicone. Failure rate is more than the male condom, which is around 5 to 20 per 100 women years. Okay. So what are the advantages? What are the advantages of using a female condom? It is under women's control. Okay. Number 2 is it prevents pregnancy as well as it prevents sexually transmitted infections. Okay. But yes, we have certain disadvantages as well, which will include the high cost of the female condoms compared to male condoms. It is expensive, and there is a chance of slippage. Okay, slippage chances more. Clear? So this is all about your female condoms. Next one is diaphragm. Okay, so diaphragm is a hemispherical. It is a hemispherical dome-shaped cups with flexible metallic spring rims. Okay. So this is also made up of rubber or latex materials. Size is usually determined by doing a pervaginal examination by a service provider. Okay. This has to be usually combined with spermicidal jelly or cream. Okay. So this is a picture of diaphragm. Okay. So this is a shape you see. This is a hemispherical dome shaped one. Okay. Yeah. So when you will be using this. So this is usually introduced 2 hours before intercourse, okay. Then it should be kept up to 6 hours after the intercourse, okay. So that is how it should be inserted and taken up. And remember, it should not be kept more than 24 hours also, because if you keep it more than 24 hours, there is a risk of toxic shock syndrome, okay. So there is a risk of toxic shock syndrome, okay. Now, what are the advantages? Advantages will include there is good efficiency of using this diaphragm, and the failure rate is low, it is around 1.9 to 2.4 per 100 women years. And another advantage is that it can be reused, okay, by simply washing and drying up to 1 year, okay. Then what are the disadvantages? Disadvantages will include the UTI and the vaginal infections can occur, and they do not provide protection against the HIV or herpes infection. Clear? So, when you should not use this diaphragm, what are the contraindications? Contraindications will include when the woman is having a prolapse or a fistula, or there is a recurrent urinary tract infection. So, these are the contraindications when you shouldn't use this, right? Fine. Next one is cervical cap, okay. Cervical cap is a, see, this is what cervical cap is, okay. So, if you see, this is a thimble like shaped cap. This is a reusable one, okay. It is made up of rubber or silicone. Spermicide, adding spermicide with it will increase the efficacy. Then this should be introduced before intercourse, and it should be kept for 8 hours after intercourse. Just before intercourse it should be inserted, and it should be kept for 8 hours, okay. Next one is spermicides. So, spermicides are the chemical agents destroying sperms, okay. It is available in jelly, cream, foam, suppositories, etc. The chemical used is nonoxynol 9 or autoxynol 9, and the period of action of any spermicide is for about 1 hour. It is to be shortly given before the intercourse, okay. So, that is why it should be given shortly before intercourse. And the main disadvantage is irritation, which can be to both partners, okay. And the last one is today's sponge. So, this is a mushroom shaped device, okay. So, this is today's sponge, which is a mushroom shaped device. Mushroom shaped device. It is made up of polyurethane, contains non-oxynol 9. Okay. Then it should be inserted 24 hours before coitus and kept for at least 6 hours after intercourse. Then it is more convenient, okay, than your condom or diaphragm. And the disadvantage is that it is less effective, and one advantage again is toxic shock syndrome is very less with today's sponge. Okay. So this is all about contraceptive part 1, where we have discussed about the natural methods of contraception and barrier methods of contraception. Hope this video would have been helpful for you. Until we meet in the next video, take care, happy learning, and bye bye.